The exploration of the dark chapters in medical science. The mission of the public health care system is to improve the health and quality of life for all humans through providing preventive care and treatment. However, historical evidence reflects several medical explorations where the poor and minorities were manipulated, injured, and neglected. As a result, there is still evidence of distrust of the medical science between the poor and minority communities today. This research is to encourage medical science to acknowledge its wrongs and impact it has on poor and minorities' knowledge today. The Oslo Norwegian Experiment. The Norwegian experiment was located in Bobek, Oslo, Norway. It was conducted with the sexually transmitted disease known as syphilis. The subjects that they used were poor white people. The purpose of the experiment is to see what effects happens to the males. To record the data, they will put the participants in a hospital to keep the disease from spreading. After an average of 3.5 months, they have all they need and let the subjects go. The experiment lasted about 19 years, through 1894 to 1910. Hole in Head. Hole in Head was a good representation of the experiment done on children. Vectress Hardiman was 80 years old before he told anyone about his horrifying truth about his head. The radiation experiment was conducted in Laos Station, Louisiana. To get parents' permission to do the experiment on the children, they would have to lie. They had to lie to the parents and said their children had ringworms, so they had to be tested on. During the experiment, Vectress was exposed to more radiation, causing his own skull to dissolve. This has caused a huge scar on the top of his head. To make sure no one would see it, he will always keep it hidden by putting wigs and hats over his head. The Tuskegee Experiment. The Tuskegee experiment was located in Macon County, Alabama. It was also conducted using a sexually transmitted disease called syphilis. The subjects used in the experiment was poor, uneducated African Americans. The purpose of the experiment was to see what effect untreatable syphilis are in the black male. This was an extension of the Norwegian experiment. The experiment went on for 40 years until Peter Buxton started to find out the true cause of the experiment. The Guatemala Experiment. This is another experiment that the U.S. took part in. It was done during the administration of American President Harry S. Truman and Guatemala President Juan Jose Olivero, with the cooperation of some Guatemalan health ministers and officials. Doctors infected soldiers, prostitutes, prisoners, and menstrual patients with syphilis and other sexually transmitted diseases, for instance, STDs and AIDS, without the informed consent of the subjects, and treated most subjects with antibiotics. This resulted in 38 deaths. In October 2010, the U.S. formally apologized to the Guatemalan for conducting these experiments. The Immortal Life of Henrietta Lacks. Henrietta Lacks was born Loretta Pleasant on August 1, 1920, in Road Lake, Virginia. At some point, she changed her name to Henrietta after her mother's death in 1924. Henrietta set to live with her grandfather in a log cabin that had been the slave quarters of white ancestors' plantations. Henrietta Lacks shared a room with her first cousin, David Day Lacks. They placed their daughter, Elise, who developmentally disabled, in a hospital for the Negro insane. On January 29, 1951, Lacks went to Johns Hopkins Hospital to diagnose abdominal pain and bleeding in her abdomen. Physician Howard Jones quickly diagnosed her with cellular cancer. During her subsequent radiation treatments, doctors removed 2 cervical samples from Henrietta Lacks without her knowledge. He had died at Johns Hopkins on October 4, 1951, at the age of 31.
Have opinions and we all have to agree. We're obstinate and so damn hard to please. And if I loved you once, I don't recall